Okay.
All right, 5, 4. Hello and welcome everyone today to the webinar. Thank you so much for coming in. We have a lot of people joining today, so it's so nice to have you in. My name is October Boyles. I'm the Chief Clinical Officer for Ichnote, and I just want to thank everyone for coming to our webinar today on empowering mental health clinicians working with gender dysphoria clients. Today, we're going to embark on a journey of knowledge and understanding and delve right into providing competent and compassionate care for individuals who are experiencing gender dysphoria. We have a lot of speakers today, so we're going to move fast through today's webinar. But if you can hear me, if you can type yes in the chat. And one thing I would love for you to share, only if you feel comfortable, is what type of clinician you are and where you're located from or located at. So I will tell you, I'm in the Charlotte, North Carolina region. It is trying to be spring here. So, but thank you so much, Emily, Nicole, Marcy, Mackenzie, Victoria, Amanda. Thank you, Deborah, Greta. A lot of yeses in here. If you feel comfortable, great. You can share in the public chat. You can share your discipline and where you're located. If you do not feel comfortable, do not worry about that at all. We also have a private chat. So you are more than welcome to communicate with us through private chat as well. So I have a lot of folks from Tennessee, neighbors here, Karen and Michaela. It's so great to have you here. Fantastic to have students, LCSWs, LPCs. That's fantastic. Case management from Michigan, Virginia. Wonderful to have you folks in here. Dakota, Los Angeles. Oh, is it warm in Los Angeles? So but we have folks from Canada in here. It's absolutely a pleasure to have you all in here today. So thank you so much for joining us. I'm going to have some polls going on throughout the webinar, and I encourage you, if you are a licensed clinician, please answer these questions honestly in the polls. What we're trying to do with the polls is gather information to help us better understand and to be used in research on this important topic. I want to give you some statistical data right before I introduce our next speaker. First thing is transgender individuals make up roughly 25 million in the global population. And the U.S. Transgender Survey reported that 39% of respondents experience serious psychological distress compared to just 5% of individuals in the general U.S. population. Individuals have nearly a four-fold increased risk of depression compared to cisgender individuals, and transgender individuals experience more significant anxiety symptoms and have nearly a threefold risk of probable anxiety disorder. Now, I'm taking this from studies. I'm one of those individuals. I love studies, so I'm going to be posting those in the chat so you can see those, have those yourself. 2 different studies, really important. But other things that we need to talk about is 39% of the LGBTQIA plus youth seriously considered attempting suicide in the past 12 months, with more than half of transgendered and non-binary youth having seriously considered this as well within the past 12 months. And 76% of LGBTQIA plus youth felt that the recent political climate impacted their mental health or sense of self. So that is one of the reasons we're having the webinar today. That is why it is so important to be here. And I appreciate y'all so much as mental health professionals, because it is paramount that we equip ourselves with the necessary tools and insights to effectively support our clients and patients on their unique journey. So without a further ado, I want to extend a warm welcome for our distinguished speaker, Mr. Donald Morrison. He shares insights and wisdoms on this important topic. So we're going to strive to empower ourselves today as mental health clinicians and better serving our gender dysphoria clients. So, Don, please take it away.
Yes, indeed. Thank you so much, October, for that warm welcome. Hello, everybody. I hope you guys are having a happy Thursday. And in the comments, too, you know how I do. If you've ever heard me speak before, in the comments, just share some good news with us. Give us something good today. We want to hear something good from you, and we are certainly excited. Our good news is we're glad to be here with you and talking about this very important issue. As October said, it is trying to warm up here in North Carolina. I'm the co-owner of a group practice here in Mooresville, North Carolina, which is in the Lake Norman area. And it is trying to warm up here, and everything is starting to bloom. So if I'm sounding a little sniffly, it's because things are blooming. And I'm excited for spring and I love it, but I also kind of hate it at the same time. You know, my hero, Marsha Linehan, says we can feel both ways, right? We can absolutely feel both ways. So it's good to be here with you today. I'm going to provide some of the DSM-5 clinical diagnostic information related to gender dysphoria, give you a little bit of history of that. And then October is going to tell me to be quiet because I can obviously talk all day because we have other guests we need to get to. But I do. Just in a general sense, when we talk about terminology too, I think it's very important for us to look at when we say the term transgender, what does that mean? And transgender refers to a person whose sex assigned at birth is usually based on their genitalia, does not align with their gender identity, which is one's psychological sense of gender. And some transgender individuals will experience gender dysphoria, not all, but some. And DSM has actually done a really, really good job, I think, in terms of acknowledging gender dysphoria. But also, I mean, we've come a long way, I think, from 1973, where DSM removed homosexuality as a clinical diagnosis. They did a little bit better in DSM-4's text revision when they included gender identity disorder. Y'all may be very familiar with that former diagnosis. But then DSM-5, when it was released in 2013, they updated the gender identity disorder to gender dysphoria. And it was a much more person-centered approach. If y'all have heard me talk before, you know I'm a huge fan of Carl Rogers. Any Carl Rogers fans, please give a shout out. And person-centered therapy, the language that we use is so very important. And we see that in the clinical documentation and research that the language we use when referring to our clients is so very important in terms of validation and affirmation, which we'll talk about those terms in a little bit too. So gender dysphoria is the psychological distress that results from an incongruence between one's sex assigned at birth and one's gender identity. The concept of congruence, and it's very important too. I mean, at a very basic level, you've probably seen on some of your mental status exams that we use that term congruent if someone's affect lines up with their mood. That means that their mood aligns with their affect. The same thing here with one's gender identity. And I think it's important to acknowledge too that gender identity is much different from gender expression, because gender identity refers to one's psychological sense of their gender. Gender expression refers to the way that they present to the world in a very gendered way. And we can talk about some of those things, but one example of that is in the United States, wearing a dress is considered generally a feminine gender expression, and wearing a tuxedo is considered masculine. But we've seen, thankfully, especially in popular culture, that stars like Kristen Stewart, Bad Bunny, yes, I'm old, but I know who Bad Bunny is. And anybody here know Bad Bunny? Bad Bunny, Harry Styles. I mean, numerous celebrities are now embracing this fluid gender expression where they wear clothing that is not always aligned with their gender, and so which is a great way, I think, of moving forward with some of these things. When we look at gender dysphoria, the DSM-5 text revision defines it in adolescents and adults, and we'll speak to kids here in a second. But in adolescents and adults, it's a marked incongruence, meaning it's not aligning between one's experienced expressed gender and their assigned gender that lasts at least 6 months. And because you know how DSM is, you know, we're putting qualifiers on things here in terms of developing our diagnosis. So they last at least 6 months. And with at least 2 of the following symptoms, and I'll just breeze through these because I know you guys are seeing these on the handouts too. But a marked incongruence between one's experienced expressed gender And by the way, we are using the term experienced gender as opposed to desired gender. That was a wonderful improvement in language that DSM-5 text revision included in their latest update. So it's a marked incongruence between one's experienced gender and primary and or secondary sex characteristics. So when we talk about primary sex characteristics, we're talking about the penis, the vagina. When we're talking about secondary sex characteristics, we usually refer to breasts, pubic hair, facial hair, menstruation, and such. So the second symptom of gender dysphoria is a strong desire to be rid of these primary and or secondary sex characteristics because of that marked incongruence that they experience. And in young adolescents, a desire to prevent the development of these anticipated secondary sex characteristics cause much distress. Also, too, we could possibly see a strong desire for the primary and or secondary sex characteristics of the other gender, as well as a strong desire to want to be treated as the other gender, and a conviction that one has the typical feelings and reactions of the other gender. It's also important to acknowledge, too, that as we talk about gender identity, we must distinguish, too, between sexual orientation and gender identity. Gender identity, of course, it's one's psychological expression and sense of their gender. Sexual orientation refers to the type of people towards which one is sexually attracted. And I believe, October, we could go to the next slide, please. When we talk about assessment and exploration, I know y'all are more than likely using a biopsychosocial assessment and to examine all of the different systems that the client interacts with on a daily basis. I think it is very important that when you're introducing yourselves, that you ask the client what are their gender pronouns. We do, by the way, in terms of language, we've kind of moved away from describing pronouns as preferred pronouns because it's not a choice for our client, right? Their pronouns are their pronouns. So, you could say they're identified pronouns or just pronouns. And when you're having these discussions with your client, I would highly encourage you that if you do make a mistake and refer to them as the incorrect pronouns, it's okay to make that mistake. You can absolutely apologize to the client and say, hey, it's you will validate them and support them, but sometimes we do make mistakes, and that is part of the job too. We can't always get it right 100%. I'd say too, not to apologize too profusely, because then your client's going to feel like, oh, maybe I need to give therapy to my therapist, and that's never a good thing. That is not their job to do. So then, of course, throughout the assessment process is exploring how their experience and everything they're dealing with right now affects them across all spectrums, whether it's work, home, school, relationships, etc. And then along with that, we can't mention gender dysphoria and some of the issues that our clients deal with without also looking at the legal procedures here in terms of what we always refer to as, in this case, as legal affirmation. This is where the client changes their name and their gender markers on government identification, and any legal documentation. I can't say for other states, but I know that here in North Carolina, you can, for driver's licenses, for example, you can get a gender designation form that's got to be signed by the applicant and by licensed professionals like us. So we got doctors, psychiatrists, counselors, psychologists, caseworkers, social workers. We can all fill out this form for our client and talk about some validation and affirmation that would really help build that therapeutic alliance that we're always looking for with our clients. So be mindful of the legal procedures too. There's also the social affirmation aspect of things where the client is adopting pronouns and names and various aspects of gender expression that align with their gender identity. And then the medical affirmation aspect of things, which we can speak more to later if we've got some time. But, this is where we see our clients who are exploring, gender affirming treatments like hormones, estrogen and testosterone, and certainly in pubertal suppression for adolescents and adults. Even there are a variety of different things. I've got some more information on this if we've got some time in the presentation to discuss it. And Eve, by the way, how are we doing on time?
We keep let's go a little bit longer. That I like to get the folks in for with the interviews. Yes. So
Absolutely,
but yeah,
absolutely.
pedal to the
Oh,
metal. You're doing great.
I feel like I'm rushing a little bit, but I don't want. It's a lot of stuff. It's a lot of stuff.
We
But
do, and to let the folks in here know today, there's so much information, and we have some wonderful folks coming up with interviews, and so this could really be like honestly a 6 hour to 8 hour webinar, and
yeah.
we're trying to do what we're trying to do in just a 1 hour. Now we will probably end up going over a couple things I do need you to know. Is that this is being recorded. So you will have the ability, if you have a client, you need to jump out. That's not a problem. It is being recorded. So you will get that recording. If you sign up for the webinar, you will absolutely get the recording. Another thing too, I just want to throw in there that we hadn't talked about is there are some handouts up at the top. And if you look at the handouts, we have our presentation slides that are listed there. Those are completely for you. And then we have a crisis intervention toolkit, which I think is going to be really helpful because it has a safety plan in there with the appropriate numbers to call. It also has a form about triggers and individuals measuring their emotions for the day, and it's just a whole crisis intervention toolkit that we've given you. That's yours as a handout. So please go ahead and grab that now, though, because it might not be available after the webinar when we send you the recording. So I want to throw that out there.
Excellent. Excellent. I do want to circle back just a little bit back to the assessment piece too, because in terms of the diagnosis, I did not mention with children, we do see gender dysphoria in kids, but from the diagnostic standpoint, any kind of symptoms related to gender dysphoria, children have to exhibit 6 or more for the 6-month period too. So they'll repeatedly say that they desire to be the opposite sex. In boys, we see a preference for cross-dressing or simulating female attire. In girls, we see where they're wearing only stereotypical masculine clothing. There's a strong and persistent preference for cross-sex roles in make-believe play or persistent fantasies of being the other sex. They typically reject toys and games typically played by one's sex, and an intense desire to participate in the stereotypical games and pastimes of the other sex, a strong preference for playmates of the other sex, a strong dislike of one's sexual autonomy, and as well as a strong desire for the primary or secondary sex characteristics of the other gender. And some of this let me just say too, that some of this may very well be quite normative behavior for children. That's why we have to take more time, I think, in my opinion, and more exploration. And of course, DSM says we have to have more symptoms in order to develop that diagnosis of gender dysphoria. But I think some of this may very well be normative. I think with anything that we talk about with DSM-5, I think that we always have to look at how much of these symptoms are affecting our clients' overall level of functioning. Again, home, work, school, relationships, social relationships with other people, et cetera, et cetera. We have to be mindful of that. Just because you have a kid that may present with some of these symptoms, that does not mean they would meet full diagnostic criteria for gender dysphoria. And let's also be mindful, since we're focusing on the gender dysphoria diagnosis here, dysphoria, which again you've seen on your mental status examinations, dysphoria is considered, I've always looked at it as the exact opposite of euphoria, which is really, really happy, obviously. Dysphoria is, in my opinion, I think it's absolutely a combination of a little bit of all of these difficult feelings: stress, anxiety, anger, irritability, depression, I mean, et cetera, et cetera. So when we talk about dysphoria, that is absolutely a mental state where it causes significant distress for our clients. So therapeutic approaches for gender dysphoria. Now, I've for folks who have heard me speak before, I am full on a cognitive behavioral therapist. So, focusing on our thoughts and our feelings so they can impact our clients' behaviors. But also, I'm a huge fan of a person-centered approach with the good Dr. Rogers. And I think too, so much of what we do as clinicians is driven by empathy and validation. I mentioned the DBT guru, Marsha Linehan, a little bit ago, and she celebrates this idea of validation. Like, we are acknowledging our clients that, hey, they are doing what they need to be doing for themselves right now. And their thoughts and their feelings are always valid. And certainly, I think that is so important in terms of working with clients living with gender dysphoria, is that we listen to their narrative. We listen with empathy and compassion, and we validate their experiences, because it doesn't take a rocket scientist to figure out that your client is, I'm sure, in their social environments, your clients have been invalidated. Your clients have been probably bullied and abused. And that's definitely something to explore in the assessment process as well. With a full biopsychosocial assessment, we do explore all of those areas. We also have to recognize the cultural and social context of gender dysphoria, recognizing how societal and cultural factors influence our clients' experience. Because as we know, gender dysphoria, gender affirming care, it has become a political issue, and we don't necessarily have to get into that now because we don't really have the time, but maybe we can at some point. But unfortunately, it has become a political issue, and politics affects us. It affects our clients as well. And there's much debate, constant debate. There's constant negative things coming out in the news. There's, like I said, other kids, other adults are bullying clients living with gender dysphoria. And this is another reason why we as clinicians want to give them a safe space to express themselves, in a safe place to unpack all of these things and to hold space with our clients. That's so, so very important. But also recognizing the cultural and social impacts as well. I have talked about before the need for assessing cultural impact and social impact on our clients' overall level of functioning and their good mental health. And the DSM-5, I think, does a great job with this through the cultural formulation interview. And how many of y'all have ever used the cultural formulation interview in your assessment process? Please let us know in the comments, because it is a thing. I don't think, in my opinion, I don't think we use it as much, but it is a wonderful tool in assessing for how a client and their family, all of the systems that they interact with and their cultural and social environments, how they view gender identity, how they view transgender individuals, how they view folks who want to appropriately use their pronouns. And that is so very important to assess. So please give yourself permission to explore those things with your client and give your client space to address those things. That's the cultural formulation interview. It is in the DSM-5 and at close to the very back, I believe. And please review that when you get a chance, because it truly is a very helpful tool in assessing for our clients the cultural impact and the cultural experiences that our clients have to deal with. And the last part here, number 3, exploring of gender identity, kind of sort of what I've said already. We support our clients in exploring and articulating their authentic gender identity. I'm a huge fan of being genuine and authentic with your clients. And I think that it's so very important, because if you're not, then your clients are absolutely going to pick up on that right away. And when I do meet with my clients, I share my pronouns with them. My identified pronouns are he, him and his. And I encourage you to do the same thing with your clients as well, in terms of openly sharing with them some of your experience. I think use of self is very important in working with our clients too. There's got to be a balance, of course, but being a true, genuine, authentic person underneath the mental health degree is so very important in terms of building that therapeutic alliance with your clients. Eve, where are we at? What do you think?
I think I want to go ahead and get started with the interviews if that's okay, because
Yes,
we have like 6 more slides. So I'd like to go ahead and get started if that's okay with you. We also have people that are
absolutely.
really doing a great job in the polls. I'm going to go over the poll numbers, so please don't just know when you're answering the polls. Thank you. A lot of people are answering them very honestly, and that's what we need.
Yes,
Because again, this is going to be used in as far as research data um, and I'm going to tell you what the poll numbers are. I'm one of those people that I like to know, so so I'm going
yes,
to share that as well. But
excellent.
yeah, I think we want to go ahead and get started. So, Angela, we're going to kind of flip screens, and we'll go ahead and bring folks in. And there we go.
I want to thank you again to all the folks that are in the webinar today. I have someone that I think has a lot of insight on this topic. She's an absolutely wonderful person. Her name is Bree, and she is a parent to a 7-year-old trans child. And so thank you for being here today, Bree. I really, really appreciate you. Um, I do have some questions for you. When we're talking about mental health and we're trying to empower clinicians, what role do you believe mental health providers should play in supporting transgender individuals and their families?
Yeah, so I feel like I come from a pretty unique perspective on this, being that, again, I am the parent to a young trans child. She's 7 years old. Really, I think our journey with, knowing that our child was trans started around the age of when she was like 3 or 4. I think it's, again, like a pretty unique perspective. It's not like, we had a teenage child who was like all of a sudden telling us that they were trans, and then we had to kind of like backpedal from there. It's really been a lot of kind of preventative, and then making sure that just like touch points to make sure that everyone is okay and we're moving in the right direction. Mental health has been a huge part of that for us, just because for me, I've always, I've had my own therapist pretty much my entire life, or really my adult life. So I believe in it, and I trust the mental health professionals that we work with. And so when I first realized that I had a trans child, one of the first places that I turned to was to my mental health professional. I ended up changing from the person that I was seeing previously to another person who had just a little bit more perspective on the issue. I was luckily able to connect with a mental health professional who had a trans child as well, which was really helpful for me. I think in the role, in my specific instance, I just needed someone to be able to tell me, all right, like I was in this mode where I had no idea what to do. I didn't know how to feel. I didn't know how to act. I didn't know what the right step was. And so having a mental health professional that was able to say, look, everything you're feeling like makes sense. There's people who have been there before, and then directing me to resources to help me kind of take those next steps myself. It meant everything to have somebody to kind of help me on that journey. And then really for my child as well. So my child, we were able to find a mental health professional that worked with children as young as the age of 5, who had experience with children who were trans. And so having somebody for her to be able to go to speak with, they do play therapy. And, I don't even know that if you asked her, she would know that she was talking to specifically a doctor. But to have somebody who was able to have conversations with her, answer questions that I'm not able to answer, and really then to be able to turn to me and say, hey, she's doing great. She seems to be adjusting well. Everything's, good. That has meant all the world. So just having educated mental health professionals who understand what it means to have a young trans kid, that it's not going to be the same as dealing with a teenager, and having that kind of breadth of experience has meant everything to our journey, and kind of keeping us away from those huge, like traumatic experiences for myself and for my kid.
That is wonderful, and I'm glad that you're able to find somebody who is able to like validate feelings, and that's absolutely wonderful. I know some of the questions I'm going to ask. This one's maybe a little bit tougher, but how do you prioritize your child's mental health and well-being in a society that may not always affirm their identity? And what advice would you offer to parents in similar situations? Because today we have a lot of clinicians in with us, but we also are going to have individuals that watch this webinar that are not clinicians, right? That are parents themselves. So
Yeah, I mean, I'm not gonna lie, it's tough. It's a really tough time to be the parent to a young trans kid because, man, it's like everywhere you turn, there are people telling you what to do and what is the right thing to do and what's the wrong thing to do, and like telling you're an awful parent for what you're doing. And so it's really hard. I think the biggest thing for me that has helped me through this entire journey is finding my people and finding resources. I was lucky enough to connect with a organization called PFLAG very early on in our journey. And they have given me the resources, to find mental health providers, to find pediatricians, to find, other parents, to find other children to connect me with and it kind of in those moments where I'm like, it's too big, it's too much, I don't know what to do. I'm able to connect with somebody else who can say, hey, I've been where you've been before, and this is how we dealt with it. And I think it's just like, it can be really isolating when you're feeling like you're a very small majority and the voices on the other side are so loud.
Yeah.
And so it's really nice to be able to kind of connect. I think that we're in this really unique experience where for parents of young trans kids, a lot of times we aren't very outspoken, and that's not because we don't want to be, it's because we need to protect our kids.
Yeah.
And right now, protecting my kid is more important than, me being out there. Like if it was up to me, I would fight everybody and I would fight every single fight. But also like my kid deserves to have her privacy and she deserves to decide when she wants to be out there with it. So finding ways that I can kind of fight the fight without being super public. And PFLAG has also helped me to do that. So for me, my mental health and how I kind of prioritize is like, I find ways to help that I can, and that is doable for me, and that I have the capacity for, in the times. And sometimes, it looks different from month to month, but finding those outlets for me has been the most helpful.
that's wonderful. That is, and I'm so glad that you were able to find those outlets. And that's one of the things that we'll talk about in just a couple minutes. But um, as kind of an advocate, and I know that as much as you can be right now, right, for transgender rights and acceptance, what steps do you believe that mental health providers can take to create a more inclusive and kind of affirming environment for transgender individuals?
Man, I think the biggest thing is just educating, and making sure that, again, there's just so much noise. There's so many studies that are cited that, aren't legit, and
Mhm.
it's hard to find good information and correct information. For me, like I'm very much like, I want to know everything. I want to know, any studies that have been found. So I think just seeking out the correct information, seeking out, people that can be trusted to talk about these issues. And I think, you know, it's one of those things where so often what people are saying, this is what you should do, is written by people who don't have trans kids or really don't even have any experience with trans kids. I think some
Right.
of the biggest things is like, you just believe people for the experience that they have. It's frustrating as a parent of a young trans kid when somebody who doesn't have any experience tries to tell me what the right thing to do is. And that's infuriating because it's like, you don't know, what you're saying isn't evidence based, and it's not even like situational based, like you just don't know. So I think the most important thing that mental health professionals can do is to, seek out people who can tell them a true perspective of what it means to be a parent to a trans kid, to seek out trans individuals and say, hey, what did you wish you had as a trans kid? What support did you need? What would have made your life a little bit easier? And and that helps when somebody comes to you in this place of trauma, of not having any idea what to do, when you can say, okay, well, based on, talking to other people or the study that I read, this is what seems to be, the most successful thing for you at this point. And so, yeah, I would just encourage anybody, I didn't have any experience with trans people, with trans children until I had my own trans kid. And now I've just really inundated myself with it. And I just realized that there's just so much that I didn't know previous to it. And I don't think any of us can be expected to know something unless we're exposed to it in an authentic way. So I would say, if you're going to open yourself up as a gender affirming healthcare provider, make sure that you are kind of entrenched in that you understand that world, that you understand the needs before you kind of open yourself up to seeing those patients.
Absolutely. Absolutely. I think you brought up a really valid and great point is there is so much noise out there. Anybody with no background can get on social media and start talking about things that they really have no knowledge about. And it used to be that if you were invited like on the news or you were listed in papers, you had to have some type of, and pedigree is maybe not the great word for it, but you had to have a really robust CV about what you were going to talk about. And now anybody can pick up a camera and give any kind of opinion and cite any study that they read that is not accurate in the way that they cite it. And it definitely creates a lot of noise. And so, what I know you talked a lot about PFLAG. I think it is a wonderful organization. And so, want to drill down on maybe the resources or support networks that were kind of instrumental for you. And what do you think mental health providers can do to better connect families with these resources?
Yeah, I mean, they're luckily, I live in a metropolitan area, so we're very lucky that there is a robust amount of resources available to us. I was able to find these, and I think again, like you don't have to do, hours and hours of research. Like just find the people who are connected there and then figure out how to connect into them. And, I would encourage, providers find a regional PFLAG chapter, find a region like a support resource for these and then get tapped into it. Because then it's easy enough to say, you've got a parent, you don't have to have like a list of resources for them. You can just say, hey, go over here. And they already have all this legwork done. I think that it's really important there's just support happens in a million and one different ways. For some people, a support group is going to be the best way. For another person, just connecting to one other single person who has had that experience is going to be the best thing. Or for some other people, it's just like, maybe I want to read 101 articles. But being able to connect any of those people with the ways and the resources that are going to work the best for them is really important. And I think just, as a parent, it's tough with a young kid because you just don't, you're in charge of making all these decisions for them. So there's a lot of pressure that's put on parents of young trans kids because you don't know the right thing to do. So really being able to like take a little bit of that weight off and say, hey, you don't have to make all these choices by yourself. There's other people that have been in your circumstance and let me help connect you to them. Even just that is such a huge weight off. And really helped me in my instance of feeling like I was just drowning in not knowing what to do, and having a mental health professional that was able to connect me with resources. It felt like they threw me a life raft in that moment, and it meant everything to me. And really has helped us to succeed moving forward. We're, I guess, 4 years now into this journey, and I have a 7-year-old who is happy and confident and has never had any issue with depression and has never had any, issue, telling people who she is. And I credit that so much to the fact that like 4 years ago and this work that we've done coming up till now, like we haven't had to deal with these huge traumatic experiences because we've been able to do this transition in a healthy way. And that's because of the support and the resources that we've had.
That is absolutely wonderful. That is absolutely wonderful. And that's one thing I think the key point and that Dawn and I were trying to make is that there's a lot of controversy around the gender dysphoria diagnosis. I think we'll touch on that a little bit later in the webinar as well. But there's two ways of looking at it. There's the DSM-5, which is kind of the Bible. And I'm not saying that in a sacrilegious way. It is just kind of the Bible for therapists, and counselors and psychiatrists and mental health nurse practitioners. But there's also the ICD-10 codes, and those are just getting further and further away from the DSM-5, which is really sad. And this is problematic. And I'm hoping that the ICD 11, when it comes out, which will be in the next year and a half, will be more culturally appropriate for some of these diagnoses, because it's very far away, not just on this issue, but even on substance use. They're still using the term like abuse, and they maybe hasn't caught up with the times. So as far as that, um, well, I know as I want to ask you the question, how could a mental health clinician kind of support you as a mother? Because you're an amazing person. In full transparency, for those folks that are in the webinar today, I knew you before you had children, right? I had met you before you had children, and you are a strong person, you're a kind person, you're a cheerleader for so many people. And we met because I was asked to be on a softball rec team because they need more girls. It was a co-ed team, right? So they needed more females on the team, and I was doing a horrible job. I've played softball before, and you were always so wonderful. It's like a cheerleader, you're doing great, keep it up. And I'm like, I just lost it for the whole team, but you were always so wonderful as like a cheerleader. And I can only imagine that if you were just as supportive just to me in those kind of instances, how supportive you are to your child. So what are some things that clinicians can do to kind of support you? I know you said it was like a life raft, but tell me some things that clinicians can do to support like you as a mother and also parents. What?
Yeah, I mean, I think it's, for me, a lot of times, like I go to my therapist, and now, I was really lucky to be able to like seek out a therapist that was familiar with, and part of the LGBTQ community, which was super helpful for me because as a parent, I am a cis het white woman. Like I've fit into pretty much every box that was ever offered to me. And so this has been a really new and eye-opening experience for me to have a young trans kid. And there's just so much that you don't know. So to be able to have a mental health professional that is able to give me a lot of times the perspective that I don't know, has been really helpful to me. And I think for most of us parents, like you just sometimes need someone to say, hey, you're doing great. Like you're doing great. And to say, for me, often I get caught up in like, I just want to fix everything. I want to like anticipate every single thing that's going to happen, looking forward on the road ahead for my kid. And I want to fix everything. And obviously you can't do that as a parent. But what's been really helpful for me is like, for my mental health, like the therapist that I go to, we often just talk about like, hey, let's look at all the things that like you have done already. Let's think of these challenges that, you've already faced and, we've come up against and how that's happened. And so I think for a lot of times for parents, you just need someone to tell you like, you're not blowing it. And that in and of itself is just really, it's great. And it's nice to have for those times, in that instance, in that 1 hour, when I get to sit there with my therapist, where I get to be the one to just like ask questions and download, because a lot of times I think people look to us parents and say like, you have all the answers. And I don't have the answers. I just have like, what I think is going to work best for me and my family, based on, the hours and hours of research that I've done. But to have somebody that, will help kind of create those answers for you and better arm you to like walk back out into the world feeling confident that you are doing a good job, has been, that's the gift, I guess, that my mental health professional has given me is like a pat on the back and the confidence to like get back out there and do it again.
That's wonderful. That is wonderful. Well, I appreciate you so much for your time. Thank you so much for sharing insight that a lot of people have never been able to speak to a parent of a trans child, right? And so thank you so much for joining us today. I think that you have given a lot of insight and a ton of insight, a ton of insight. So thank you so much. Thank you so much.
No, thank you. I appreciate it. And, I appreciate you guys speaking about this subject. It is so incredibly important. And I think it is kind of, it's a small but mighty group of people. And I think that it's getting bigger and bigger. You find that there are more and more parents who are, affirming their kids at a young age. So it's new and it's new. And, the amount of people who are like, you're so brave, like, you're so brave what you're doing. And like, I think about it and I'm like, you know what? It shouldn't really be brave or like this crazy thing for you to just support your kids for who they are. But it's crazy that in this day and age, like you kind of have to be ready to fight these battles and fight this fight. And I think for the mental health professionals, like just educating yourself so that you can help, arm the people who are going out there to fight this fight, that helps, and that means everything. And it helps us to do what we need to do out in the world.
Absolutely. Well, thank you so much. Thank you.
All right, that was awesome. And chat, you guys are amazing as well. Thank you so much. So
Yes, indeed.
yeah, they're wonderful. All right, we've got I have some other folks coming up. We have a wonderful couple. So give us just a second. We load them in.
October, you had some great interview skills, might I add. Wonderful.
Thank you.
All right. Well, thank you so much for joining us today. I want to introduce a couple, Mary and Thane. Thank you so much for being a part of the webinar today. I know that people are excited to hear a little bit of your story and your journey. And would you mind introducing yourselves, please?
Thane. I came out 2020 and I have been transitioning since then.
I am Mary, she, her. I have been with Thane for 10 years, so prior to his transition and since.
That's wonderful. We're so fortunate to have you guys here today. Thank you so much for joining us. And I have some questions that for both of you, kind of related to working with mental health clinicians and bettering maybe the mental health that individuals receive. And so, Thane, do you mind if I get started with you first and ask if you can answer some questions first, not to put you on the spot, but
Yeah, it's all right.
you're fine. You were doing great. You're doing great. So, what are some things that you faced through your transgender journey that relating to mental health specifically? Do you mind?
Yeah, well, I was in therapy prior to coming out, and my therapist, she was the one who helped me navigate how to come out to people when I was finally ready to come out. So she was super helpful in that sense. But my biggest struggle since then has been finding someone who is relatable to me. I actually stopped seeing her because she just wasn't as relatable. Like she was really good prior to then, helping me with like my past traumas and stuff like that. But like when it came to present things and my transgender journey, like it wasn't a good fit anymore. And I tried like two other therapists since then, and it just can't really find someone who can relate in any way.
No, that definitely that that makes sense, and it is so important in mental health finding someone that one you can relate to, and two that you can establish a good personal relationship because you can't just do that with anybody, right? And so that's definitely so. Thank you so much for sharing that. Mary, what can I ask? What barriers you faced when you're looking for support for either yourself, your partner, your family?
Yeah, so I think the biggest hurdle that I faced is that it's really difficult to find providers that are openly affirming of our community. And so the only place I know of to easily look for a provider is Psychology Today, because you can filter on, your insurance and things like that. And there is a section where people list, the communities that they serve, and filtering on people who actually serve the LGBTQ plus community narrows it down a lot, quite a lot. And so finding people who are openly affirming and serve our community is difficult. I don't know if providers realize how often patients actually use psychology today to find providers, but that has been the big.
But my biggest struggle since then has been finding someone of the transgender community, and that was somewhat helpful in terms of I was able to find 2 other therapists in the area to be able to relate to or to try and see.
Right.
But that same person was trying to do a transgender support group. And I thought the idea and the concept was really good, but she just couldn't get it off the ground, unfortunately. But I was able to find like a virtual one, which was very helpful. And so I think that if more therapists could try and create support groups for transgender people, that would be very helpful, because if they can't provide some insight on how they on how to navigate certain things, other people's experience might be able to do that for you. You know what I
Absolutely.
mean?
Yes. No, that makes total sense. And that kind of ties into the next question I was going to ask, like what resources would have been helpful or still be helpful to individuals. And so tell me about support groups. Did you feel like that played kind of a pivotal role? It sounds like.
I think it really did. So it wasn't, it was Facebook groups, so it wasn't like super uh what's the word? Very interactive. Yes, thank you. It wasn't super interactive, but what I was able to do was just put a post. It was a private post on that private group of, hey, this is what I'm going through. Can anyone give me some advice? And like there were some interaction, some advice, and that was very, very helpful for me personally, because what I couldn't find with my therapist, I was able to find with other members of the community, and it would have been even more so helpful if I could have had that in person, even today. I'm not in the same stage I was at one point, but still there are things that come up in everyday life that I would like someone to talk to with. And like right now, currently, I don't have someone that I'm seeing. And I don't really know other transgender folks in the area that are in my same age group that I can relate to and create friendships with and be able to, hash it out with. So I just have to rely on the online support group and the little bit of interaction I get. So like if I was able to have in person support groups like this, I feel like it would be better.
Absolutely. Absolutely. No, I hear that. Absolutely. No, Mary, I want to switch and back and ask you, what's something that you wish mental health providers knew about the journey of the partner or the spouse of a transgender individual? What are some things that you would want to
Yeah,
let
I
them
the main thing that I think would have been helpful for me, which I would have never saw coming myself either, but I didn't expect it to challenge my own identity. So, having been a member of the community prior to his coming out, I identified as a lesbian, and I identified that very strongly. And so when he came out, I had to question my entire identity. And so it was almost like his coming out and finding his identity put my identity into crisis. And I don't think that there's a lot of support for how to navigate that, right? How to carve out your own new identity and new space. And it may seem silly to want a label or to want a part that you fit into, but the thing is when you've been ostracized from the general community and then you find a home and a community within the queer community, then you lose that little piece there because you no longer fit the definition of what that label was. Then you kind of feel adrift and you don't know, where you belong anymore. And it's very difficult transition to go through. And so it would have been nice if the mental health providers, and I have a wonderful one, but it would be nice if mental health providers educated themselves more on our community and understood the nuances of things like that, and the fact that, you know, a partner coming out could make you question your own identity and where you fit and what your label is, and how to cope with that and how to navigate, you know, redefining yourself.
And I think that that's something that I don't know that a lot of clinicians, I don't, even myself would not have thought about that before. And so I really appreciate you bringing that up. That's definitely something I think it's thought provoking. It's definitely something for folks in here to consider in the webinar as well. Um, so, and Thane, can I ask, what's an important part of the transgender community that you would want mental health clinicians to know?
I think the most important part would be to be aware that every transgender person is different. And every transgender person's definition of what it means for them to be transgender is different. And so you cannot treat it like the common cold, for example, and these are the symptoms and these are the treatments and everything's all fine and dandy. Like, that's not how it works. It's very different for every person. My journey is very different than X, Y, and Z, you know. What I consider my definition of transgender being is very different from someone else, and that other person and the other person. And so it's very important that mental health providers understand that they cannot treat every patient the same way just because they're transgender. They need to be able to figure out and navigate that person's experience and help them specifically.
That's an excellent point. That is an excellent point. And Mary, do you have anything you want to add to that? I saw you kind of looking over and nodding. So yeah.
Yeah, I just, another thing had come to my mind too, in terms of things I wish people knew, that I had not thought of until he said that. As I was also thinking about the fact that I wish more people understood how much loss is associated in terms of like how many family and friends you lose when you come out, and not just for him, but for me as well. Like, for when you come out as transgender, a lot of people, you know, aren't supportive of that journey, and they just don't want to know you anymore. And so there is a huge loss of social support in our personal lives. And, you know, there's just so many hurdles with that. There's hurdles in finding jobs. You know, there's just so many things that it affects literally every area of the person's life, as well as their family members' lives. And so that was the thing that kind of popped in my head when he was talking there.
Word.
So you're definitely in agreement. So that losses. What are some things? One of the things that and in full transparency, I know Thane and Mary. I am fortunate to have them in what I consider my friends group, and so I have known that we haven't got to hang out in a long time due to COVID and a lot of other things, but I'm very fortunate to have you both in my life and to have met you through acquaintances who I still consider really good friends. And so but let's talk with the losses that you're experiencing. How, and this is kind of, I'm going off script, so I apologize. But what are some things that you do? Because we're talking a lot about today mental health providers and clinicians and what they can do to help individuals. But what are some of the coping skills that you have both used? It just in general, whether it was going through COVID or just in day-to-day life to kind of help you. Do you mind sharing that? And you don't have to, because that was not a question we talked about before. So.
Yeah, I think one thing that we did, we leaned very heavily into our local PFLAG group during that time. Losing a lot of family and friends meant we really needed community, and it was really difficult because this was all happening during COVID and during lockdown. So it's really difficult to have any kind of community during those circumstances. But even emerging from that, when the world kind of sort of started to try and get back to some sort of normal, we found that not a lot of our people made it through the journey with us to that point. And so we leaned really heavily into spaces that we knew were queer friendly, to try and rebuild that community. There's a very small amount of family members that we have. And so losing family and friends makes it difficult. So you just kind of have to look where you can. And so for us, a lot of people, as adults have trouble finding community, but when you're queer, that adds another layer because not every space is welcoming to us and to our community. And so PFLAG was a huge source of community for us, and has been since before his transition, but they were super supportive during his transition. So that was a big source for us. And then we also just kind of started looking online for places that, queer people gather and have, game nights or whatever, or trivia or, things like that. We just kind of started looking for places that offered queer friendly experiences and went there to try and rebuild community. It's honestly still a journey of rebuilding community for us. It's still something that we're struggling with because there's just not a lot of places in the South where you can have that. And so, and especially if you're not of an age where you're still like going to bars and clubs and things like that, it's even harder.
Yeah.
Once you get to a certain age and that's not really what the experience you want anymore. And that's a big space to find queer community. So if that's not your spot, it becomes a lot harder.
And I think also like it's important. Like personally, I would love to find a new therapist that I could work through this with right now. Cause like my main coping mechanism isn't healthy. I've just suppressed and gone to anger. Like I'm just angry at those people currently. That's how I'm dealing with it. And I know it's not healthy and I know I shouldn't be doing it that way. Like I logically understand that I shouldn't be doing this, but it's the only way I can cope because it's very painful losses for me. And so, it's something, and it's not something that just one and done. It's something that keeps up and occurring and keeps being thrown in your face over and over and over. And so, like, if I could just, it's like the whole point of this is being able to more easily, accessibly find clinicians that I can work with would be very helpful so that they can help me find better coping mechanisms rather than just resorting to anger.
Yeah.
Right.
Because to his point, it hasn't, there were some initial losses when he came out, quite a few, but then maybe a year or two will go by and then there's another loss because slowly someone has completely removed themselves from your life. And then maybe there's another loss because, people have very harmful views towards the transgender community and you didn't realize that before and now you do. And so there's losses that just keep compiling. And so if you don't have that support to turn to when you're going through that, you don't know how to process it other than to just be angry.
Well, and that's part of the stages of loss is anger, right? And that's definitely understandable. That's definitely so. Well, I do feel like after the webinar today, you're going to have a lot of people that are going to be offering. So I do want to go and give you that heads up on that. But I just appreciate you guys being so open and honest and sitting down and having this conversation because it's something when we talk about wanting to empower clinicians on helping people, it is what is most important is to understand where the people are coming from, right? And what the needs are. And I think you both talked about particular needs that maybe clinicians hadn't thought about,
Right.
today. So that has been just very, very helpful. Is there anything else that you would want mental health clinicians to know? Is there anything else?
You got anything else?
We dove deep. We dove deep.
We did dig pretty deep.
Yeah.
We covered a lot.
Yeah.
Well, listen, I want to thank you so much for being part of the webinar today. And I think that everything that you said is very thought-provoking and will truly kind of help some individuals today. And I think everybody agrees with that. So thank you so much.
All right. Well, I just want to, again, the two folks that were the folks that we interviewed, the two interviews were absolutely amazing. And as that's represented in the chat as well. And so thank you, chat, for being so supportive of these folks, and also being here today and answering the polls. We are already at 104, so we are over time. I am going to really quickly show you some of the things that we do in iCan Notes to help with the things that we've talked about today. So I'm going to go ahead and share my screen, because I think that it's really important that whatever electronic medical record you're using is really incongruent with today's standards. And one of the things that Dawn talked about was the cultural assessment, and we have that here in iCanotes. As you can tell in iCanotes, we have lots of different adult assessments. We could just keep going. We also have children assessments as well, but that important assessment that you spoke about was in here. Another thing we do in iCanotes is when we go in to the demographics at the very beginning of the note, we have the gender listed, and then you can drill down on expression, orientation, identifier, cultural belief, and preference, and you're able to really drill down on these things within the iCanotes. And then one of the things that iCanotes is most known for is going to be our content, right? So if we go into our therapy notes, we can talk about some of the things that were mentioned today, like grief. I think that Mary and Thane talked about that and expressed that. We could talk about grief, anger, anxiety. Depression could be some of the things, and I could say depression is present, and I could say that maybe it's chronic and the person's having difficulty concentrating and maybe crying spells and fatigue. And we could talk about sadness, if that continues, if it's better, same, or worse. And then suicidality. As you can see, iCanotes kind of writes the note for you. I could say they're not suicidal, or their denial is convincing. We can drill down into behaviors. If they have a normal MSE, I can hit normal and it gives me a beautiful MSE. But one of the things that uses the patient's name and their gender, whether it's he, she, or they, throughout the entire note. And so we have suicide violence risk assessments. You're able to justify level of care, and you're also able to link in your treatment plans directly into your note. So you have a beautiful progress note that looks like you've been typing all day. Now, listen, we did not get, in full transparency, and Dawn can agree. And Dawn, are you muted? Here, let me get you unmuted. Unmute. We did not get to go over everything that we wanted to today, but we and I think that I'm going to send out the last poll I sent out, and I can talk about our poll results a little bit here, but we can absolutely come back and do another webinar, provide more handouts, and I want to give you these poll numbers if that's okay. Folks have said, when I asked, have you encountered challenges in accessing resources or support services for patients with gender dysphoria? 71% said yes, 29% said no. I said, do you believe there's a need for more research and evidence-based practices in the field of gender dysphoria treatment? 99% of you, 155 people, said yes. So
yes.
Would you be interested in receiving additional training or resources? 97% said yes. And then, have you received specific training or education on gender dysphoria and transgender healthcare? And 35% of you said yes. And I think that's a really great number. And 65% said no. It said, are you familiar with available resources for individuals experiencing gender dysphoria in your area? And we have 43% said yes, which is fantastic. So that's kind of our poll results. I like to, when people are engaging in polls, I'd like you guys to know the results, and we'll be happy to put up another webinar and do something on on the same topic. And Dawn, thank you so much for joining us today and being here with us. You were super helpful. And also to the folks that came in, to Brianna, Thane, and Mary, thank you so much. And to our wonderful webinar attendees, your chats, you've made the chat lively and engaging, and it just made it really put the cherry on the top of the cake. Or is it
We
ice cream?
love it. We absolutely love it, no doubt. And yes, October, thank you for allowing me to be here and to share. And thank all of you guys out there who are doing such great work with your clients. Please, please, please keep that going. And you know what I always say, we've got to keep hope alive out there. And please don't also, as I might, if I can add one more quick thing, please take care of yourselves. We got to do the good self-care because we need you. We need good folks out there doing what you're doing. So thank you for spending your time with us today. And in October, I guess we're coming back for the sequel.
Looks like it.
Yeah,
Absolutely.
let's do it. Let's do
Yes,
it.
yes.
Very much looking forward to it. Thank you so much, everybody.
Thank y'all.
Take care.
Bye-bye.
Bye-bye.